more on the new coronavirus projections, let's bring in our Dr. David Agus. He's at home, too, in Los Angeles. David, good morning to you. You know, Dr. Fauci says don't get discouraged. We keep hearing, good morning to you. Dr. Fauci says don't get discouraged. We keep hearing it's going to be another difficult couple of weeks, which is also very frightening. The projections are 240,000 Americans could die. So my question is, how do we not get discouraged, and why are the numbers jumping so high so quickly?
Well, we've made an impact, right? With no behavior change at all, it will be 1 to 2 million people dying, and we're down to 100 to 200,000, which is still way too high, but we need to do much more. Many of us are, as you're doing now, staying in your home and social distancing and really playing by the rules. Some are not. Some parts of the country are not equal to others, and we all have to step up. There really needs to be a step up. States like Florida and Texas have to step up more. We all have to stop this spread, and we're going to make an impact. We have to look at, the medical care we're doing now. Can we optimize it? Can other states learn from New York City what they did right and wrong and improve the care so those numbers come down?
You know, Dr. Burke said there's no magic bullet, there's no vaccine, it's just behavior. And what you just said, not everybody's following the rules. Do you think now we have to have a federal mandated law where people are just ordered, this is what you have to do?
Listen, this is my opinion only. The answer is yes. I think we need to get normative behavior change as a country. We need leadership. And the leadership needs to come from the federal government saying, hey, as a country, we're all going to step up. We are in this together. If a few people do the wrong thing, it hurts everybody. We saw that picture this weekend of a beach in Florida that was totally empty because that county said nobody can go out and go on the beach. The county next door didn't have that rule. And as soon as you see the county line, you see people lined up and smushed together. We can't have that. We are in this together. Your behavior affects your neighbor and vice versa.
What do the new models show about the difference in cases between New York and New Jersey compared to other parts of the country?
Well, New York and New Jersey now, the United States is the epicenter of this virus in the country. New York and New Jersey are the epicenter of the epicenter. And, obviously people smushed into subways and on the street before this happened enabled pretty rapid spread. My hope is those same slopes don't happen. When you look at cities like Los Angeles and San Francisco, just a couple weeks ago, they were exactly the same point New York City is now. And you see in New York City with this crazy increase in number of cases and not in the others. And so I think they had started earlier and doing better in California with the social distancing, and it works. It ain't fun. It ain't good for our pocketbook, but it works. And we all have to do it and be very strict about it.
Everybody keeps hoping treatment, vaccine. What can you tell us about the latest treatments? Anything?
Well, yeah, there's a study out yesterday from China where they randomized to hydroxychloroquine versus standard care. And in that study, and again, it wasn't the best study. You can complain that it was Chinese doctors. Do we trust the data? But there was a dramatic improvement in the group that got the hydroxychloroquine. And that's about all the data we have now are these small Chinese studies. I hope and pray that the data in the United States comes soon, that we can learn from every encounter that we're doing, because we're treating patients now, but I want to know what's working. That's critical to flattening the curve.
Yeah, everybody's working. Thank you very much, Dr. Agus.